Hello friends, very happy new year to you. This is Dr. Kaushik Sundar, stroke and interventional neurologist at RN Tagore Hospital, Kolkata. I am sitting before you to answer a few frequently asked questions on stroke. So the first question that is always asked is, what is stroke? Stroke का मतलब क्या है? Is it a cerebral? Is it a heart attack? Now stroke is a very commonly used clinical term to denote some problem with the blood vessel that is supplying blood supply to the brain. So if there is a blood vessel that gets blocked, it is called an ischemic stroke. If the blood vessel starts leaking, it's called a hemorrhagic stroke. So in simple words, stroke means brain attack. If somebody says that I have had a stroke, it means that there has been a problem with the blood supply to the brain. That's the first thing. Another frequently asked question that they say is, how do we know that a patient has had a brain stroke? So the easiest way to remember this is by using this acronym BEFAST. What does BEFAST mean? B stands for balance. If a patient finds difficulty in walking or needs support to walk suddenly, then that is indicative of stroke. E is eye or vision problem. Suddenly he sees blurred vision, or he sees things double, or he is not able to see things clearly at all. That could be an indication of stroke. F, facial weakness. Many a times we see these patients have their angle of the mouth deviated to one side like this, टेढ़ा हो जाता है. So that also is an indication of stroke. A is for arm or leg weakness. Somebody is not able to hold things very tightly anymore, or whatever they pick they tend to drop it, or they are not able to wear their footwear, they are not able to lift their hands up or their legs up. Arm or leg weakness, that is also indicative of stroke. Then S, speech difficulties. Patient who was speaking very clearly and suddenly goes in for a slurring speech, they are not able to speak clearly, they are not able to gather their thoughts, that is also indicative of stroke. And then T, that is time. That means that immediately you should get this patient to the hospital as soon as possible. So balance B, E that is eye or vision problems, F facial weakness, A arm or leg weakness, S speech difficulties, and T that is time to get this patient to the hospital as soon as possible. That is B fast. Third frequently asked question, what happens if you get the patient quickly to the hospital? Are we being able to do some treatment that is different? And the answer is yes, especially for strokes which are affected because of blood vessels that are blocked. So in today's modern area of medicine, we can give a drug called thrombolytic agent. We can immediately dissolve the clot so that the blood supply to the brain can be restored. The other thing that we can do is a procedure called mechanical thrombectomy, which means that you can go inside the blood vessel, catch the clot and remove it. You can see my other YouTube videos to understand what mechanical thrombectomy is, but these two are beautiful new techniques that can help us recover patients from stroke. Now if the blood vessel has leaked, we have surgical options as well. We need to go in, we need to give the brain some space to expand, we can even remove the blood clots from inside the brain, all that can be done. So if you reach the hospital in time, then treating you becomes easy, and that is why even in the acronym BEFAST, T stands for time to get the patient to the hospital. Fourth, sir, stroke ho gaya hai, we have treated, how long does it take to recover? We have to understand that stroke recovery is slightly slow. The reason is because once the damage is done, the brain goes into a reset mode. It takes some time for this brain to recover. Even major procedures that we do on brain, sometimes we wait up to 3 months to see whether this patient has a good recovery. So today you get admitted, tomorrow you give some medicine or surgery, and day after you cannot expect the patient to start walking normally. You need to give them time, you need to give them rehabilitation, you need to give them medicines, and all that helps this patient recover over time, usually 2 to 3 months. That is the time that we wait to see a good recovery among stroke patients. These are few frequently asked questions which I thought I should share with you. As time goes on, I will answer some more questions. But remember, Be fast, help us serve you better. Thank you.